The Multi-Body Subject-Specific Institute, or ITMO, for Health Technologies has two main missions. First, like all the ITMOs, to define a strategic vision of the scientific fields it covers, and then to establish coordination between the operators in those fields. The fields that have been defined so far for health technologies are imaging, biotechnology and bioengineering, all aspects of drug development, surgery, radiotherapy and aid for the disabled, and a field that has recently been introduced, e-health, for electronic health, which covers remote health care, establishing medical databases, and all this depends heavily on IT capabilities. The Health Technologies ITMO still has relatively small logistics resources. It's run by a team of 3 or 4 part-time staff, myself and 3 people helping me, but most of the work is done in committees. We have a college of scientific advisors and a project steering committee, each involving 20 or 30 people. The work of the Health Technologies ITMO is done by this part-time staff. Our funding amounts to a few €100,000, so it's relatively modest so far, allowing us to animate meetings. I hope it will increase so we have more resources to achieve our objectives. The first objective was to draw up what's called a strategic document, defining the fields that concern us, the laboratories to work with, the strengths and weaknesses of the French system. It took us about a year to achieve that objective, and now we're working to try and improve the weak points we identified in that strategic document. I'll take an example first in the field of imaging. It's thought that while our development of cameras, image acquisition and image processing has been significant, and France is well represented, when it comes to development of the molecules used for imaging, for example radioactive imaging, we've made less progress. So we decided to set up a working group to try and determine which are the best candidates among these imaging agents and how we can help get them to the stage of clinical application. That's the kind of thing we work on. As far as valorization goes, our work mainly consists in setting up committees that will either study application projects and try to structure them so they have the strongest chance of actually being implemented, or consider how best to promote contact and discussion between the various research organizations and industry to make the whole process more fluid. So one of our first aims is to see that in all the projects in which organizations in the alliance are involved, one single person is given a mandate by all the others to negotiate with industry so as to simplify the circuit of legal and economic decisions which currently paralyze a certain number of projects.